Well, let's take a look at this now. The public protector has visited what she's described as one of the worst hospitals she's ever seen. Thuli Madonsela expressed shock at the conditions at the Postmasburg Hospital in the Northern Cape. Well, let's chat to the public protector herself, who joins us now on the line. Advocate Madonsela, very good morning to you. Thanks again for joining us. You've described the state of the hospital as quite disappointing. What was it in particular about the facility that left you disappointed?
Good morning. And good morning to the listeners. It was equipment. It wasn't a terrible hospital in terms of the quality of human interaction. The problem was that it was worst resourced in terms of equipment and clinical staff.
Let's take an in-depth look at that now, the lack of equipment and the clinical staff. I understand one doctor was present at the facility, only one nurse overnight. That could be a disaster waiting to happen.
It is a problem. Although the staff are quite professional about it, they do manage it. But it is a problem in that they say that the registered nurse is running the whole hospital at night, meaning if there's an emergency in the maternity ward or in the pediatric ward, she has to make a choice which to prioritize. And if there's an emergency elsewhere, it's always a balancing exercise. We were also worried that the pediatric ward did not have a fully qualified nurse. The nurse there is a community service one, and she is supposed to work under supervision, but because of the inadequacy of staff, she is working alone. But she is, again, very professional and very passionate.
Now, as the go-between between government and ordinary South Africans, how do we propose that we remedy this situation? How do we fix it?
It's already being remedied. From our discussions with the province, we were told that 2 doctors resigned. So the process is on the way. It just took a while because they resigned 2 months ago. They are also making efforts to talk to the private sector so that doctors that have their own practices could spend a couple of hours in the hospital. In the long term, we will engage with the MEC in each province and the minister at national to look at how do they balance their limited budget to make sure that strategic areas are well-resourced. Our concern at the moment is maternal mortality and child mortality. So when those are under-resourced, it has implications for our achievement of Millennium Development Goals.
Now, we hope to see change, obviously, on the ground there as soon as possible. But if we can, for just a moment, let's stray from that issue and go to the much more contentious issue that we have at hand, that ever-elusive Nkandla report. When can we expect it?
Soon, Ayanda. We have finished it, for sure. We are waiting for just a response to some issues that arose after we dealt with all of the information that we already had. We were hoping that we'd get it sometime last week, but indications are that we'll get it this week. When that comes, it will be factored in. It shouldn't take more than a day to factor that in, and the report will be given to parties that are affected by it as a provisional report. Then later, it will be released as a proper report.
And there are no indications of exactly exactly when that is, if I may probe a little bit deeper. A week, maybe 2 weeks?
The final report, we have said that the outer deadline for us would be the 15th of September. We don't see any reason why we would not be able to release it by that date.
I'll have to leave it there for now until the 15th. We hope to speak to you again. Thanks for joining us. Public Protector Thuli Madonsela.
News that moves. eNCA.com.